And if you haven't done so already, please put your name and your state or organization in the chat box, as this helps us track attendance. In addition to that, we will not be using our microphones today, so feel free to mute yourself and turn off your video if you'd prefer. At any time, if you have any questions, you're welcome to unmute yourself or put your question in the chat box, and we'll be sure to monitor it to answer them as needed. In addition to that, closed captioning is available to today's webinar. You can turn on this feature by clicking on the live transcript button at the bottom of the Zoom menu. And if you need any help with that, this is a newer feature for us, so just let me know and I'd be happy to help you with that. And now I'm gonna turn it over to Matt to do some more intro stuff.
Hi, everyone. It's really great to see everyone. Even if you have your camera off, it's great to see your blank screen or your picture. That's awesome. Good crowd here today. Great topic. As we get started, we know that you guys probably already have a lot of questions about this type of subject, so feel free to get your questions ready or get ready to pop them in the chat box. And we have a bunch of staff here from the federal level and from TASC and SHIP, and Angie's here, so we'll do our best to make sure you get the right answer. At this time, Krista at the federal office this is her first webinar with us, and so I would like to take the time for her for them to take the opportunity to introduce themselves and share a little bit about what they do.
Thanks for that, Matt. Hi, everyone. Once again, I am Krista Mastel. My pronouns are they, them, and I am your new SHIP program coordinator. I'm also the project officer for states in Region B, D, and E. So while I'm still relatively new to SHIP, I am not to FORP, having moved over to this program from our Black Lung Clinics program, where I worked with providers, administrators, and benefits counselors to support the needs of coal miners for the last almost 4 years. And just on a personal note, I'll mention that I grew up in a small rural township in Minnesota, only about 3,000 people. And it didn't even incorporate into a city until after I was already in grad school. So in all sincerity, rural America truly holds a special place in my heart. I want to thank you all for your timely and thorough NCC submissions. It was a great opportunity for me to learn more about you, your hospitals, and your programs. And I look forward to hearing more as we continue to collaborate to support your small rural hospitals. So thank you again. And with that, I'll turn things back over to Matt.
Thank you, Krista. If you have not had a chance to engage with Krista at all, they are wonderful and amazing to work with, and it's been a great opportunity so far. We will have a couple assessments that go out, one from the federal office and then another one from us, our customer service satisfaction, that will both happen over the next few weeks. So be looking for both of those. And Krista is going to host a open office hours on April 4th and 5th. Caroline will send you invitations to those. You can join either or both if you're super into it, I guess, and we'll be happy to answer any questions you have and get to introduce and talk a little bit more. But be looking for both of those surveys. You guys know that, as you know, at your level, survey feedback is really important to our success and how we measure things. So we are going to be doing our spring update to our allowable investment tool. It's kind of our 2 times a year major update. So if you have suggestions of how it should look or categories or things of that nature that you think should be included, shoot us an email. We'll be more than happy to take a look at that. We are having a lot of discussions in the background about what that can look like. And we have recently determined that Health Equity will be the SHIP Learning Collaborative that we host this year. And so be looking for more information about that coming up in the near future. So that's kind of what we have. For those of you that work with both Flex and SHIP, we have requests for proposals out for the RSV. RSV's coming up. We also have the customer service satisfaction for Flex out right now as well. So please make sure you're replying to those. And at this time, I'm going to go over today's objectives, and we are going to launch the pre-poll. The pre-polling questions are concerning my knowledge on leveraging your state's SHIP and Flex programs. Those are your options. And then kind of curious as to how much time you spend managing your SHIP grant each week. So 15, 5, 3+ hours, etc. If you wouldn't mind, answer those questions. And today's objectives are to recognize program overlap between SHIP investment activities and Flex program core areas, learn how to assess SHIP hospital activities and performance to plan and implement complementary work plans, and discover approaches for state SHIP to utilize funds to foster improvement in preparation for value-based purchasing, accountable care organizations, and payment bundling through individual hospital investments or state SHIP consortiums that also further flex program goals and financial operational quality improvement and population health. That's a very long objective, but you guys get the point. Discover approaches to our core areas there. And at this point, let me introduce Angie. I don't think she needs an introduction, but I'm going to give her an introduction because she's awesome. Dr. Angie Charlotte is a registered nurse with over 30 years in healthcare. She has a bachelor's degree in nursing, a dual master's degree in both healthcare admin and business admin, and a doctorate in business admin. She is certified in both Lean Six Sigma and Black Belt in Six Sigma. She has over 12 years in rural health, helping hospitals and clinics improve workflow, enhance quality outcomes, and implement new service lines within their hospitals and clinics. Dr. Charlotte also serves as the Chief Nursing Officer for Customer Learning and served as past president for the National Association of Rural Health Clinics and Illinois Organization of Nurse Leaders. Dr. Charlotte, I'm going to hand it over to you. Thank you for being here. It is always wonderful to have you, and we are looking forward to what you have to share today.
Thank you so much. It's telling me I cannot share. So there it goes. All right. Okay. Well, everybody, welcome again. And I absolutely love being here. So when I was asked to talk about SHIP and flex program activities, it was really a little bit overwhelming. When I first started in rural health, and oh my gosh, I can't remember how long ago it's been. First, I didn't know what a critical access hospital was. So my level of intelligence to rural health was very frustrating and very shallow, coming from an urban university. And then it was, oh no, that's a flex program. Oh no, that's a SHIP program in the hospital setting. And I'm like, what is that? So when I left that, moved into hospital administration and then back into rural health again for 11 years in the flex and SHIP for Illinois. First, I started in flex. And when I first started, I didn't even know what the SHIP activities were. I didn't know, that our SHIP coordinator was doing different activities. So it was very, very confusing. And, I can feel your pains, your frustrations, and looking at what are we supposed to be doing and how do we align this? And so when they asked me to talk on this topic, I was like, oh my gosh, yes, let me, because as you know, we just reviewed these objectives. And this webinar is really to look at the approaches on how we overlap and complement each other's work plans. It's not to give you the programs, it's not to give you the vendors or, all of that direction. It's to help you look at how do these align. I learned a long time ago from the federal office, the gal that was working with us really did not have a lot of knowledge in healthcare. And we throw out acronyms like, the dozens, and there's always a new one coming out. So we really had to work together to look at, okay, what is SHIP doing? What is Flex doing? And helping her to also help us coordinate the efforts. So again, we're going to talk and we're going to flip back and forth between all three objectives. And you're going to see that these slides aren't fancy, they're for talking points. And I really, really, really want you guys to chime into the chat box. My friends over there at the offices are going to be monitoring that, so we can jump in at any point in time and talk about your questions or your needs and how we can help. So let's look at the SHIP investment activities. So these should look familiar to most of you. Now, where I came from in Illinois, we had two different coordinators. So our Flex coordinator, our SHIP coordinator, seen two different spreadsheets. They didn't see all of this. Here is SHIP. These are the three main areas: value-based purchasing, accountable care organizations, and then your payment bundling or prospective payment systems, PPS investment activities. And then you have all these subcategories. And then if you go out under the National Rural Health Resource Center, or the center as I'm going to call it from here on out, and look at their resources, there's just a plethora of things that you can find. And then we have Flex, and Flex has 6 core areas, of which Two are required, are quality improvement, and that is for critical access hospitals, whereas SHIP also is for 49 beds and less. So there's a little bit of a difference there. And you'll see quality improvement also looks at SHIP. That was value-based purchasing. That was straight up the same stuff. And then we have our operational and financial improvement. That is also embedded into that ACO and that payment bundling sections. Population health improvement can also be in your ACO initiatives. Rural emergency medical services, and looking at the improvement plans that you can do with that. That is a whole nother initiative that, you know, can be embedded into ACOs. It can also be embedded into quality, depending on how you're using your EMS. You know, innovative models of care, you know, oh my gosh, that is everywhere. That can be any of your process and efficiencies. It can be the care you're providing in ACOs or those shared savings programs and the development of. And then obviously the CAH designation is a required one should you have a hospital that is seeking, you know, to become a CAH. So assessment of current activities. This is really just kind of looking for some overlap, and we're going to dig deeper closer to the end of this as we go along. But when we're thinking about our current activities, what did SHIP allocate for? What were both the outputs and the outcomes? And I use outcomes, I will tell you, a little bit interchangeably with outputs. And please don't confuse that, because the outputs truly are what we create immediate, you know, with immediate gratification. You know, here's what we did. Here's the numbers of things we did. The outcomes tend to take a little bit longer to get our answers. You know, did it really work? It's that level of achievement as we go forward. We have that list of best practices from prior funds, you know, and hopefully we have started to collect some of that. And I'm going to show you that a little bit more later. Survey, you know, all our eligible hospitals. I don't care if they don't participate in anything, survey them anyways. You know, look for ways to help them. I cannot say enough about doing the surveys about 6 months out from when you are writing your grant cycle plan, your work plan. It really does help. And then we want to compare all of those SHIP activities to our flex activities, both past and current, because as you know, they overlap. You know, their grant cycles and fiscal years are a little bit different. And then what are our current deliverables in process? You know, are we building on something then that SHIP can truly look at moving forward, you know, and kind of take it from there. If our flex project is ending in July or at the end of August, maybe SHIP would take over in January and build on something from that. Yeah, and then we compare, cross-examine, we identify some trends, and we build. So, but we're going to dig a little bit deeper. Here are two slides that are two screens that you should look at and are very familiar with. The first one on the upper left is our SHIP. So that is our SHIP spreadsheet. Who's doing what? What did they select? What are their activities? And I'm going to tell you one of the tips that really helped me early on, which I had not thought about at first, is if you take that Excel file, copy it, open a new tab, and then you scroll and take only those that are participating in value-based purchasing. And then the next tab are only those participating in ACO, and label them that way. It gives you an idea of who's participating in what without having to scroll through up and down and really look at, okay, who is doing what? The one on the bottom is the work plan for Flex. One of the things that I will tell you I did horribly was attendance. I cannot say enough about really trying to capture your attendance of the hospitals attending. And then you also want to evaluate those outputs to outcomes. You know, our PIMS data, as we all know, is a little bit lagging, especially when it comes to like entering your HCAHPS data and a few other of your MBQuip measures that we have to do. So we do, that is more of our outcomes. It took a while to get there, you know, but we do want to look at some current data and what are we doing to really have some of those outputs met. And then did the hospitals from SHIP participate in any of our Flex projects? I think that's probably one of the hardest things for us to really kind of start to build is, okay, who's doing what? And are they participating? Is it of value? And are we truly offering the right programs to meet our hospital's needs? So let's look at an example. So this is probably happening already somewhere along the line. I am taking just the first one, value-based purchasing, it's equality. And I live and breathe in quality, so I can speak fluently to this one. So we have our value-based purchasing investments. We're doing quality reporting, we're doing quality improvement, we're doing efficiency trainings, MIPS trainings, maybe we're doing something in the clinic side. Flex also, MB-Quick reporting also falls under SHIP. Reporting on our quality data, looking at, improving the quality of care, how we're doing the efficiency and the training of what we are doing. And, our clinics can overlap a lot in this as well. So here's 2 initiatives in both grants. And you'll see this a little bit better maybe in the next screen as we talk about it. But on our SHIP grant, our hospital selected an individual hospital rather than a consortium project. And they are subscribing to their HCAHPS vendor. And their HCAHPS vendor, and I know a few of the vendors out there do this, they will also assist in reporting your MB-Quick measures and some other quality measures. So that's what they're using their SHIP funds for. Flex, on the other hand, has said, and now this is truly one of the Flex measures that we had done a few years ago, we're looking at helping our hospitals measure MB-Quick, and it doesn't matter, what we're doing, it's just that looking at, okay, is there overlap? And is there a way to monitor compliance, success factors, as we look at this? We wrote in that we're going to assist on education and training for antibiotic stewardship, which is also part of the quality reporting through NHSN, and it's one of the MB-Quick measures. And then looking at our data system and reporting from all cause, in that quality measure. So what we're going to do is we'll look at it a little bit differently here. So we have our hospital under SHIP. They're using using monies for their vendor and reporting. On the Flex side, it's providing a little bit more detail on the education pieces. So they definitely have some overlap, but they're not doing the same services. So ABC Hospital reported purchasing software, they are reporting 3 of the 4 domains in the past 3 quarters for their MB-Quick. So, they're doing what they said they would do. Flex is saying, hey, we've offered antibiotic stewardship courses, and ABC is reporting their annual facility survey that they should through NHSN. And they started to demonstrate improvement of their 7 domains that they had to report on. They have actually shown improvement in 2 of the areas that they were lagging behind in. So you can see where they truly do ebb and flow a little bit, but until you put them side by side, you just don't know. And that's where it really, we get into the detail. So let's look at a consortium activity. One of the things, and this is, an Angieism, I really struggled with getting hospitals to take part in consortium activities. Am I giving you the right thing? Am I giving you the right idea? The right subject matter, the right vendor, the right consultant, what is it that they were looking for? I really wanted to build those consortium efforts, and it was so hard. And a lot of our hospitals, one year we said consortium or not. And if they didn't select consortium, then they didn't attend some of those. So it was like, okay, what can I do differently? So on our SHIP consortium, we have ICD-10 training. I am using this vendor as just an option. And I know he's been out there quite a bit in multiple states, so you probably recognize them, Arch Pro Coding. And what they offer is a 2 or 3 day boot camp on coding billing specialist boot camps. So this really is in our value-based training piece of it, as well as our ACO, as well as our payment bundling. I mean, we can embed it in any of those measures. So we offer this 2-day boot camp. 12 of our CAS, 5 of our small and rural non-CAS participated in this event. Flex complemented this. They purchased the coding books for all of our CAUs. They offered quarterly training and updates, best practice sharing, peer group activities. I cannot tell you enough about how much peer group activities have been a blessing in multiple states in getting, building people together. We offered scholarships to CAUs and RHC staff to attend those boot camps. And then lastly, we offered 10 participating CAUs, 10 audits. And what they did was they would go back and audit anything after they had had the training. So did they miss anything? Did the training work? Was it a success? And then we compared that to 10 non-participating CAUs and auditing about 6 months post-course. So our measurement actually was our attendees, obviously, and then how many actually took the certification test and passed it successfully if they chose to go that route. And then our audits. And were our audits with and or without additional findings and opportunities? Was it a success? Looking at the number of attendees, was this something that was very popular? Did folks want to be part of this? So another one is improving processes and efficiencies. I know Matt shared, I'm black belt in Lean Six Sigma. Very rarely use any of that. If I do any, it's usually in Lean. And the Baldrige framework of all is very successful in that training, but they overlap. And if you remember, when we looked at our SHIP 3 areas, our improving process and efficiencies was letter C in 2 of them, letter D in the other. And it's always an improvement in our flex funding and our flex activities. So we have this structure that we can embed and build on top of each other. But, then we go to, wait, there's more. Then there's more activities that we can build with this. So this is the Small Rural Hospital Improvement Project, the SRHT. And I don't want you to forget these things. When you start looking at your programs and you want to build your consortium efforts, go back and look. And I know this takes time and it takes a little bit of digging, but it's worth it in the end. And look at some of those other best practices, recommended strategies. Was there any specific companies out there that were doing some specific areas of improvement for these hospitals? And as they develop these toolkits and these quality improvement projects, can they work in our SHIP grant as a consortium effort? And then we're going to take that one step further and look at, okay, how can Flex complement that? But it's truly going to be the challenge of getting there and looking at who is truly doing what. So this is where, we really have to do a little bit of digging, do a little bit of, okay, what do we know? So in my second slide, we talked about doing that baseline assessment. Let's survey our hospitals. Let's survey them for their current needs, but also let's survey them for how well did we do last year? Did we meet their needs? And then we're going to also want to look at in our SHIP funds, who used monies for what? Again, building those tabs ahead of time. Once you get that framework built, it really is a little bit easier. Are they using funds repeatedly for the same service selection year after year? If we were to look at, just the past 2 years, even 3 years, and it's hard right now because these last 2 years have been in our COVID pandemic. So it's a little bit different, but are they using it for the same HCAHPS vendor? If they are using it for the same HCAHPS vendor, let's go back and look at our PIMS data and our MBQuick data. Is it making a difference? Are they improving? Are they getting any education out of that vendor? What else are they doing with that vendor? And then are they participating in any other services? Was there a crossover? Did Flex offer something that they said they were using also SHIP funds for? And I'm going to show you some examples here in a minute. And was it successful? So what hospitals do not utilize SHIP funds? So like I said, we offered a consortium 1 year and we had several hospitals bow out because they didn't get the individual funding that they wanted and they used it for charge master review and HCAHPS. You know, and that's, you know, so we had to revisit that and say, okay, what do we want to do? Because we don't want them to lose out. But what can we provide assistance to them to participate? You know, is it because they didn't want to track the work? How can we make that easier for them? You know, some simplified forms of keeping track of what they're participating in. In review of the previous year, what hospitals participated in our flex funded activities? And I know it's a long shot, but looking at that PINS data, did it improve? Were outcomes, you know, those longer range goals, were they demonstrated? And then also were our outputs demonstrated? You know, as we know, when we write our flex grant, we typically utilize a logic model. And, you know, did we meet everything? Did we get good engagement? Are we getting the same hospitals over and over? Are there some hospitals that aren't participating in either one? Are they part of a system? You know, what is it that, you know, might be holding them back? How can we help them differently? And then 1 year, we also evaluated our vendors, and I cannot tell you, that was one of the best things I ever did, because I just didn't know who all these consultants were, who all the vendors were that were providing some of this information. And it was like, okay, how would you rate them on a scale of 1 to 5? Would they be a 5? Would they be a 3? Would they be a 1? Would you use them again? Why or why not? You know, and we created that list. So some of our, you know, especially new CEOs, CFOs, you know, new butts in seats had an idea of who to look for, because they may be new in the hospital and they don't know where to go. And that they could be new in that role. They came up through the ranks and it's something new. And best practice sharing activities. Hands down, this is probably one of the best things, I think. You know, when we look at our discovery, what best practices have we shared? You know, what best practices can we continue sharing? Are there some best practices that have spurred more attendance, more questions, more attention than others? Especially when we have our peer group calls. And, you know, let's say we're bringing together all of our quality directors for you know, a Zoom meeting, and they all get on and they're all talking about these things that they've been doing. You know, which one really seemed to target home that we want more information on to share with everybody? You know, and then looking at, okay, can we create some tools and resources based on these best practices, and how would we share them? You know, even at the center level, you know, they can put some of these things out there, and please, and by all means, I beg of you to do this. Because this is how we learn state to state, you know, and this is how we get together and we see what others are doing, you know, and learning from everyone. So we have the feedback, we have the data, and then it's like, okay, now we got to talk. You know, if we are not the same person, you know, Ship and Flex, then we need to get together and communicate with each other and look at, okay, what are you doing? What am I doing? How can we work together? What are the hospitals requesting? Is it allowed in Ship? Is it allowed in Flex? You know, where can we best utilize our funds? And then, you know, we also want to look at our QIOs. In Illinois, we have the Quinn QIO Telegen, and they cover 3 states. Now, this is a blessing, in my opinion, because when we look at that, they actually have a little bit farther reach in best practice sharing. And what are they doing in the realm of quality, antibiotic stewardship, HCAHPS, you know, any of those quality of care outcomes, chronic care management, working with transition care management in the ACOs, really looking at, okay, how are we getting folks involved in what? And then, you know, looking at what's the best program to offer moving forward. Were certain vendors highlighted? You know, these are our top 5 vendors, consultants that everybody seems to really like, and they've come highly recommended. If we were to offer a consortium, should we at least offer 1 or 2 in every area, value-based purchasing, ACO, and then payment bundling? Do we want to offer only in one section, and then the other 2 sections will complement with some flex funding? You know, what's going to work best for us? Do you need a consortium, you know, to offer a consultant? No. You know, you can look at We have our consultants out there. They can offer individual consulting with our hospitals through a consortium, as well as looking at, building some ongoing webinars as a group, and everybody learns from each other. Looking at an advisory group, having that advisory group help build those complementary work plans and truly evaluate the voice of our customer, our hospitals. What is it that they're really looking for? Here's the information that we have. Here's the questions we asked. Now what? Really kind of building that out. Some other ways to look at this are evaluating what we offered the prior year. So we have payment bundling example, and this is rev cycle management. We had 10 hospitals under SHIP participating in consortium investment work in that prior year. 6 additional hospitals used it as an individual investment. So our outcome, actually outputs, are 6 of the 10 consortiums demonstrated and implemented efforts to achieve outcomes. 2 of the 6, truly demonstrated what they said they were going to do. Flex complemented that through a rev cycle management webinar series. So outside of the individual work and the consortium project, we had 10 CHs receive monies for a consultant to provide assessment and performance improvement. And we also had the webinar series, which really gleaned a lot of interest. So we can see 8 CAs demonstrated improvement within 6 months, 25 CAs participated, and we had our staff members participated for a total of 18 CAs. But what does this really tell us? So when we look at it, 34 hospitals of the 38 in our state participated in some form of payment bundling. So that tells us that there is a huge need and, huge interest in what our hospitals are looking for. So if we didn't receive a lot of feedback, we at least know, hey, this is a heavy hitter. Everybody wants to be in on this, and what we can also look at are, of these 18 under Flex, did they use their SHIP funds for something else, to be a member of their ACO, for their HCAHPS vendor, for their charge master review, so they couldn't use the funds to do rev cycle management or some other work like this is listing, but they are moving in that direction. So again, it tells you that the funds are working the way they should. So 340B, here's another example. Here is one that says, hey, under SHIP, 4 hospitals selected individual investments, to implement and support their 340B work. We did not offer any kind of consortium work. So in our outcome output, all 4 in the process of implementation at the end of that year 1, at the end of that cycle. Flex also offered a webinar series because we didn't know what was happening in SHIP because there was no consortium work. So we offered a 6-part webinar series. 26 of our 32 CAs participated in that webinar series. And 24 out of those 26 had implemented 340B activities by the end of the grant year. So was this successful? Yes. Did they complement each other? Yes, by all means they did. What I would be concerned with are the 4 that actually selected it with investment on their own. What can we do to get them to be fully implemented by the end of our Flex grant year? Could they benefit from our 6-part webinar series, to help assist them moving along? But again, it shows, a little bit of variation when we look at all of the programs that we offer. So, and again, I don't have a lot of slides, but I really want to answer questions, learn from each other. But there's so much that we can learn from. And the first one is communicating. If we are not the same person, it's communicating with each other, setting those quarterly, monthly meetings saying, hey, what are you doing this month? What are you doing this month? If it's especially in consortium work, if it's individual work and the hospitals have selected individual activities, are they evaluating their consultants, their vendors, whatever they're using their funds for, to say, hey, this one was really good, this one was not so good. No, we lost interest in this and had to request a change in the utilization of our SHIP funds. And, we want to evaluate that and say what happened. We want to look at, that spreadsheet, when we go back to, looking at our SHIP funds, where did they go? Were they utilized correctly? Which, we know they are, but efficiently. Did we really evaluate what we were doing? And so I'm going to go, please bear with me, I'm going to go back a few slides. So when we start looking at Flex and SHIP, there's so much in our SHIP investment activities. And we need to really look at, okay, are we meeting our customer needs, our hospital needs, our clinic needs, our provider needs? Are we achieving quality of care outputs and outcomes, both? Looking at those immediate gratification of our outputs for the long-term outcomes results. And our outputs of SHIP, because they are more immediate on some of these activities, can blend into the outcomes through Flex moving forward. So when we break these down, I would love to answer questions in breaking these down and helping you to decipher. I didn't want to pick apart each one because some of you are more experienced than others. You're new in this role and looking at, okay, what can I do a little bit differently? But we are all here to help. Whether you reach out to one of the folks at the center, your HRSA liaison, looking at, any one of the consultants that you utilize, we're here to help you to make this better and more efficient. The struggle is, and I remember, pulling out my hair, thinking, people, give me an idea. Just tell me what you want, and look at how can we make this better? I want to give you money, but I want it to be utilized to the best outcomes possible. And what is that? What is that for your hospital? What is that for your community? And what is your greatest need? Let's look at, okay, if you want 2 areas and the funds only support 1, let's look and see what we're doing in Flex to say, hey, we have a lot of people wanting this, but they can only afford this one. Let's look at how we can really blend the 2 and complement moving forward how these work. So just like we talked about, the billing and coding, they truly can complement each other. We can utilize, rev cycle management is another one. HCAPS is another one. Are they using the same vendor? Are they getting the same outcomes repeatedly? Or are they improving? And then sharing those best practices, creating some toolkits, from those best practices and, creating those toolkits. It doesn't have to be detailed. Some of the best ones have been, here's what I implemented. Here's the PowerPoint I used to train my staff. Here was their immediate feedback. And this is how it went. And share some of those, successes, but also some of those struggles along the way. And look at, okay, they had a struggle at 3 months implementation. So what can we do to help overcome that? Learn from each other, but build on each other and make it better. And it's getting your hospitals to work together and really helping, share those best practices, pull it out of them. When you're doing your data reports and you're evaluating all of the feedback you're getting from your SHIP activities, we start to look at, hey, what have we done? We can see everybody has implemented something, everybody has an output or an outcome. And what does that look like? Did we achieve success? And if it's something that was finite, that it's, done, and now the next SHIP grant activity, is going to be a little bit different for them. Let's look at that as building a best practice and sharing that and making those resources available. I'm going to stop sharing here. So, and really now start to open up questions here to say, hey, what can we do differently? So Matt, were you following along in anything? Do we have any questions?
Yeah, no, I was following along. Thank you, Angie. And this is the perfect time to ask questions specific to this if you have them. But I'm interested in hearing from some people, whether in the chat or speaking up and saying something out loud. What are y'all struggling in this area? Is this something that you want more information on? Is this something that is, give me some examples, I guess. What can we work on here?
And when you say struggling in this area, what do you mean? SHIP and Flex working together?
Yeah, like, is there a struggle or is there a success? How are you managing it?
So one question Kate asked is, what method do you use to survey your hospitals? So anybody that's out there surveying right now, we use SurveyMonkey. You know, it was easy. But I know others can, you know, look at that as well. You know, would anybody be willing to share your survey? So as a new Flex Ship coordinator, I have definitely struggled trying to figure out how to align the two. You know, and isn't it crazy? I'm going to point out to Gina because she's put it on here. There's so much information. And, you know, it's like, okay, what do I do? And I'm telling you, once you get that 30D done, you know, that initial discovery, it does start to flow and work a little bit better. And again, we're here to help, you know, reach out, you know, to Matt or to myself or to anybody else. You know, we're here to help you, you know, to make this crazy world a little bit easier for you, walk you through some of those resources and help you.
And I'd like to throw out the question, do they have to align?
No.
Devil's advocate, do they have to align? Because whoever, I don't have the chat open, whoever put that question in, struggling to making them align, I think it can be a little easier on yourself. I don't think they necessarily have to. I mean, I definitely work to make sure, you know, we don't double dip and they don't overlap and we don't use two funding sources for the same thing that you really want to watch for. That piece might even be more important than making sure they align. It's just an argument to throw out.
And they don't have to align. I know when I was asked to do this, it was to look at those alignments. But they do not have to align. And please don't feel like you have to align everything in this. It's just looking at how can we complement what we're doing and achieve a greater output and outcome. Misty.
I like it phrased that way. I like it phrased that way a lot.
Yeah, thank you, Catherine, for saying that. Angie, Kyle has had their hand up for a second now. Kyle, did you have a question?
Thank you, Matt. Thank you, Angie. I have a couple of just comments. Really quickly on SurveyMonkey, we are not allowed to use that within the Wyoming Department of Health for security reasons. So just to be aware that there are some survey tools out there that, you know, your organization may not be okay with, and SurveyMonkey is one of them that the Wyoming Department of Health doesn't support. In aligning the SHIP and the Flex for the Flex program for year 3, we had that quality improvement project and we chose HCAHPS, and it was easy for us to align that then with SHIP. Now, understanding that I only have 16 critical access hospitals and I only have 2 additional small rural hospitals. So I'm only talking about 18 hospitals, but we talked to all 18 of them about just using their SHIP funds for HCAHPS. And then that aligned with our Project 3 quality improvement project, which was improving our HCAHPS scores. So we were able to align the two. And then we were able to, because we're very careful again about what's a Flex program activity that we should only be inviting critical access hospitals to, and then what are activities that we can combine the two. And so because we were doing HCAHPS and because we were looking at it for quality improvement, but for also financial improvement, we could include all of the small rural hospitals in those activities. We also include all of the hospitals, the cause and the small rural hospitals in our financial improvement calls, because we do have with the SHIP, the value-based purchasing. And as I'm starting to work on the Flex program NCC under financial improvement, there's 2.5, which is value-based payment projects. So again, I can align those two and say, you know, with the SHIP, we're going to provide you these financial improvement webinars or roundtables, and they're really supported by the Flex program as well. So I do find it fairly easy to align the two and really supporting each other, right? You're going to use your SHIP funds for your HCAHPS vendor, and we're going to use Flex funds to improve those measurements. Thank you.
Great feedback.
Yeah, that's really awesome. Thank you for providing that feedback. And several people have mentioned they use Qualtrics, Jotform, Google. If your state uses a Google format, Gmail format, Google has Forms. that you can use as well, as does Microsoft. If you're using a Teams or Microsoft Office format, they also have ones.
I actually have seen Misty's in Qualtrics, and it really is good. I am a Qualtrics user and one of their consultants, and it really does allow you to play with the information then a little bit and look at, you know, your metrics and build them out. So it is a very nice tool.
Carl mentioned that too, that different email systems don't allow surveys or emails through like Constant Contact. Yeah, that's hard because you can't create, I mean, that's a big barrier because you can't create 25 surveys on 25 platforms in hopes that you get 10 responses. That's a colossal waste of time. So yeah, that's
You know, I can also share one of the things we did one year. It was truly, we brought in an intern. We weren't using SurveyMonkey at the time, and we brought in an intern and asked them to create a Word doc and send it out to all the hospitals, ask them to fill it out or do it over the phone with them and complete the form and then put it into a database. Again, it's an option, especially for those of you that are working in universities and you've got a student that's looking for a project to complete. It's great for those that are in IT and have to build a database of some sort. But yeah, it's just an option to toss.
other feedback do you guys have or questions that you might have around this area? I know Gina's been working really hard. Tiffany in Missouri said for her office, I'm a flex coordinator and my coworker is the SHIP coordinator. When she sent out a survey for the SHIP program, she got answers from cause that help the flex program to gauge interest and needs our hospitals were looking for information on. That's great.
Yeah, that is great. You know, and you truly can build off of each other. And it's so nice when you can do that.
This is really good feedback, y'all. It's really great. We love hearing success stories. And when we know that other states do too. And it's interesting to see how we can, correspond these two things without, overstepping our boundaries and the roles that we have to play, but also just, you've heard me say every webinar, like we're all here to help people get the best rural healthcare they can possibly get. And if there's a way that we can make that happen even more, that's an incredible feat that we can accomplish.
And for those that are new in this role, please reach out, and we can hook you up with a state that's really been at it for a long time. And, you can learn from some of them as well, especially if you've come from the world of project management, not necessarily healthcare. It is a whole new world. And when you get on the center's website, I will tell you, there is a lot of stuff out there. So it takes some navigating and it takes some time.
Yeah, and anybody will tell you, I think Catherine had mentioned it, and everybody else will tell you that it takes a moment. You're going to have to understand SHIP and you're going to have to understand Flex separately before you can kind of look at them together and cohesively. So don't rush yourself and get ahead of you. Stephanie, I see that you have your hand raised. Do you want to ask a question?
I was just going to make a comment. So one of the things, I'm both, so that helps quite a bit as far as the collaboration piece, but I think virtual site visits are also a platform for collaboration. I think we learn a lot from our hospitals when we're being open and asking questions and probing. And I think a virtual site visit is an opportunity to kind of share opportunities through Flex, right? And about everything that's going on. But I think it's also a platform to see where people are at with their existing SHIP activities and find out what their challenges are or opportunities, because when they're talking about maybe some gaps, you can always recommend, if they need to reallocate their SHIP or if they could be thinking about SHIP in the future. So I think that's a great platform for some collaboration if you are two different people doing it, working together for those entities. Like in Idaho, all the CAHs are SHIP hospitals, and so it's made sense to have one person doing both. But I know it's not the same in every state. But I do think with those particular hospitals that have both, having both people present on a virtual site visit may also help lend itself to ideas in the future.
Yeah, that's awesome. Thank you, Stephanie. That's really great comments there. Somebody mentioned about, Johnny had mentioned about the evaluation slide. All the slides will be made available when we make the recording available.
Yeah.
And John asked a great question too. He says that his 8 CAUSE and 1 SHIP hospital can never tell the difference between the two. And he asked if there were any tried or true definitions that anyone uses. And of course, Misty, Misty said that like SHIP provides direct funds and Flex provides resources and training. And that's pretty on the nose. Anybody else have any other way to help keep them separate or explain it to people? Somebody just asked me what I did the other day, and I stumbled around for 3 minutes before I was like, hold on, let me tell you the difference between these things. So,
And for John's question too, the only thing I can say that might be a little bit different, and I really love Misty's response, that was great, just spot on, is that SHIP requires more reporting. Looking at, how did it end up at the end, and looking at what they utilized the funds for if it was not a consortium project that they didn't participate in. So.
And that's actually not true for us. So I don't know if that's going to be the same in every state or not. I'd say our Flex grantees who participate in our initiatives arguably have more reporting.
okay. Yeah, I would just say there probably is the way each state does it and the way, whether or not the programs and the activities that are being participated in on both the SHIP and Flex side is going to determine how you define it. But it gets mixed up a lot.
Yeah, Carl's saying the same thing. She can also see how confusing it can get, the 5 CHs and 42 SHIP hospitals. Yeah, definitely. It does get confusing for the hospitals. And sometimes I just want to say, this is a grant project. It doesn't matter where the funds come from, but you want them to know, you want them to understand where the funding is coming from to make them successful.
Well, where the funding comes from, and then I think Catherine hit it right on the nose too, is how are you going to report it? Because those are two separate things as well. We got about 4 minutes left. Feel free to ask any questions you have. Did Sally, Krista, anybody at our level, did y'all have anything to chime in with?
I'm just pull up, someone asked about the evaluation slides, and we do have the SHIP performance management evaluation guide. So I'll put that as a associated resource to what Angie shared.
Yeah. And we're going to go ahead and launch the polling. I will tell you, somebody asked earlier about the SHIP, how much time was granted on SHIP thing. So as you answer that post-polling questions, this is the slide of the answers, the feedback we got. Inadvertently, we had a big gap between 5 and 15 hours, but right now it looks like most of our people spend at least 5 hours. More than a quarter spend 15 hours. Those are most likely your full-time SHIP employees. And then about 50% spend between less than 5 hours a week managing the SHIP grant. So that's pretty telling and eye-opening. And so take a minute there to answer those post-polling questions. Angie, we always appreciate you. And appreciate everything that you do for us and the insight that you provide. And of course, guys, we appreciate everybody and their participation and their being here today. Again, keep an eye out for some invites to open office hours with Krista. If you're going to submit a request for a proposal to present at the RSV, please do that this week. And yeah, you'll be hearing from us, and we'll follow up with this information as soon as we get it up and on the website. So we appreciate you again. And thank you for everyone who participated and offered the suggestions and feedback. We really appreciate you guys. It's a group effort and we're all in it together. So
definitely share with each other. I highly recommend that all the time. Oh, thank you for that resource, Sally. Very nice.
So that's awesome. Well, thank you guys. Y'all have a wonderful afternoon and we will see you next time. Thank you.
Thank you, Angie.
Thank you.
Thank you.
And we'll share the link with you as well.